welcome to another edition of Between Two Molars. I'm one of the molars, and I have a couple extra molars to help me out. Dr. Everts is unavailable, and we have a very special day. This is episode 127. So welcome, Stephanie Gibson.
Thank you.
Welcome, Angie Gold.
Excited to be here.
Welcome, Karen Goss, the star of the show.
Oh.
Now, Karen, you're the star of the show because 3 reasons. You brought a great dad joke. You're retiring, and you didn't you hit a 40-year milestone at practice? Is that right?
Yeah. Yes.
Damn, that's amazing. All right, dad joke is yours.
Okay. I used to be addicted to the hokey pokey, but then I turned myself around.
Dr.
That's
Everts
good.
would be proud.
Yes, he would. I like that. Good joke,
It's really a
Karen.
dad joke, isn't it?
It is.
Stephanie got on the pre-show. She's like, "I'm ready. I got one." I'm like, "Stephanie, it's not about you. You can do the next show." Right?
That's fair.
Fair. All right. So, Stephanie, why don't you ask Karen a couple questions?
This is going to be an easy one. Who are you going to miss the most?
Why, you, of course.
No, I'm just kidding. What was your favorite thing that we moved to during all the years? All the different transitions we did, what was your favorite?
It wasn't DSN. I think doing the same day surgeries consult thing, I think that was the best thing I think that we did. I think that was a good thing.
I mean, I'll say what was cool is that Dr. Atwell, who had practiced, I don't know at that point how many years, we come back from COVID and he's like, let's do it. And he had never done same day surgery. And it was amazing. So
He was always agreeable to everything.
Yeah. Agreed.
He was very agreeable.
So, Karen, what did you love about oral surgery so much?
It was something a little bit different every day. It wasn't boring. It wasn't the same thing. The people were different. You didn't have to see the same people over and over and over again. Your patients were always new and different.
Oh, that's good.
So, and there was always something strange and new that would show up, randomly. A patient would have a rare something or a new something or 2 sets of wisdom teeth, just something unusual.
So you had an incredible career here. What would you tell somebody new in their career to be excited about, or what guidance would you give them?
To learn all of it, to observe the surgeries, to know what they do back there, know what they do in the front and how it happens, and to know everything from the front and the back.
So be inquisitive, something like that?
Yes. Don't stop learning. Always be curious.
Oh, that's great advice. Angie,
That was
anything from you?
So I know we're going to miss you. You said you're going to come back and visit. Tell us a little bit about, you had 40-year career with us, but then we partnered with OMS 360. Tell me how that felt and talk to someone who is about to go through that, and what advice would you give them?
Oh, stay up to date on everything, because all the technology and all the new systems and things, they'll pass you by. If you don't keep up to date, it will leave you behind in the dust. So.
Yeah, I mean, I remember the first time I had to get on a Teams, it was very clunky, and now I feel like an expert. But what I want to remember is what it feels like for the first time for these new office managers, right? All of the stuff is new. So, but as long as you keep an open mind and you're a change champion, here we are right now.
Well, that's the thing, I guess. Be willing to change and accept that your way is not always the best way.
Yeah.
So
also great advice.
So be willing to try somebody else's way for a change.
Aaron, I heard a funny one the other day. It said, people complain about 2 things: the way things currently are and change.
Yeah, I have to agree with that one. I'll agree with that one.
Hey, you're an inspiration. Thank you so much for everything.
Well, I've gone in my career from thinking I was going to grow up to be the next Della Street in a law office. I was legal secretary, then general medicine, and then pathology, did autopsies and things for a while. and then
Wow.
ended up in oral surgery. And that was the place I was happiest.
We're glad you did. Thank you so
Absolutely.
much.
All
Loved
right,
working
thank
with you,
you.
Karen.
It's
Happy
lovely working with
retirement.
you. Thank you.
Congratulations.
Thank
Enjoy.
you.
All right. Bye, everybody.
Bye.
Bye.
Bye.